Gallbladder removal, also known as cholecystectomy, is a surgical procedure to remove the gallbladder. The gallbladder is a small, pear-shaped organ located beneath the liver, responsible for storing bile, a digestive fluid produced by the liver. Bile helps in the digestion of fats, and the gallbladder releases bile into the small intestine when you eat a meal. While the gallbladder plays a role in digestion, it is not essential for living a healthy life. Many people live normal, healthy lives without a gallbladder, and gallbladder removal is a common procedure. Reasons for gallbladder removal. There are several reasons why someone might need to have their gallbladder removed. One of the most common reasons is the presence of gallstones, which are hard deposits that can form in the gallbladder. Gallstones can cause significant pain, block the flow of bile, and lead to inflammation or infection of the gallbladder, which is a condition known as cholecystitis. Other conditions that may necessitate gallbladder removal include biliary dyskinesia, which is a condition in which the gallbladder does not function properly. And finally, we have gallbladder polyps, which are growths that can sometimes become cancerous. Symptoms indicating the need for gallbladder removal often include severe abdominal pain, especially in the upper right side, nausea, vomiting, and jaundice, which is a yellowing of the skin and eyes caused by a buildup of bile in the blood. Types of gallbladder removal surgery. Gallbladder removal can be performed using two main types of surgery: laparoscopic cholecystectomy and open cholecystectomy. Laparoscopic cholecystectomy is the most common method and involves making several small incisions in the abdomen. A laparoscope, a thin tube with a camera and light, is inserted through one of the incisions, allowing the surgeon to see inside the abdomen and remove the gallbladder through the other incisions. This method is minimally invasive, leads to less postoperative pain, and has a quicker recovery time compared to open surgery. Open cholecystectomy involves making a larger incision in the abdomen to remove the gallbladder. This method is used when laparoscopic surgery is not possible, such as in cases of severe inflammation, infection, or scar tissue from previous surgeries. Open cholecystectomy has a longer recovery time and is associated with more postoperative pain. Preparing for gallbladder surgery. Before gallbladder removal surgery, patients undergo several pre-operative assessments and tests to ensure they are fit for the procedure. These assessments typically include blood tests to check for any underlying conditions that might complicate surgery, imaging tests such as ultrasound or CT scans to visualize the gallbladder and surrounding structures, and sometimes an electrocardiogram to assess heart function. Patients are usually advised to avoid eating or drinking for several hours before surgery and to stop taking certain medications that can increase the risk of bleeding, such as blood thinners or anti-inflammatory drugs. The pre-operative phase is crucial for identifying any potential risks and planning the safest approach for surgery. The surgical procedure. During the surgery, the patient is placed under general anesthesia, which means they will be asleep and pain-free throughout the procedure. In laparoscopic cholecystectomy, the surgeon makes 4 small incisions in the abdomen and inserts the laparoscope and other surgical instruments through these incisions. The surgeon then carefully removes the gallbladder and closes the incisions with sutures or surgical staples. The entire procedure typically takes about 1 to 2 hours. In an open cholecystectomy, the surgeon makes a larger incision below the rib cage on the right side of the abdomen, removes the gallbladder, and then closes the incision with sutures or staples. This procedure usually takes longer than laparoscopic surgery, often lasting 2 to 3 hours. Post-surgery recovery. After the surgery, patients are moved to a recovery room where they are closely monitored as the effects of the anesthesia wear off. It is common to experience some pain and discomfort at the incision sites, as well as bloating and shoulder pain from the gas used to inflate the abdomen during laparoscopic surgery. Pain medication is usually prescribed to manage this discomfort. Most patients who undergo laparoscopic cholecystectomy can go home the same day or the day after surgery, while those who have open cholecystectomy may need to stay in the hospital for a few days. Patients are given detailed postoperative care instructions, including how to care for the surgical incisions, signs of potential complications to watch for, and activity restrictions. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Home care and recovery. Once at home, patients need to follow specific post-surgery care instructions. This includes keeping the surgical incisions clean and dry, avoiding heavy lifting and strenuous activities for a few weeks, and gradually resuming normal activities as advised by their doctor. It is also important to follow a special diet immediately after surgery. Initially, patients are advised to eat light, easily digestible foods and gradually reintroduce more complex foods. Fatty, greasy, or spicy foods should be avoided as they can cause digestive discomfort. Drinking plenty of fluids and eating smaller, more frequent meals can help the digestive system adjust to the absence of the gallbladder. Recovery timeline. The recovery timeline varies depending on the type of surgery and the individual patient. Most people who have laparoscopic surgery can return to normal activities within a week, while those who undergo open surgery may need 4 to 6 weeks to fully recover. During this time, it is essential to watch for signs of complications, such as increased pain, redness or swelling at the incision site, fever, or jaundice. These symptoms should be reported to a doctor immediately. Potential complications. Although gallbladder removal is a common and generally safe procedure, there are potential complications. These can include infection, bleeding, bile duct injury, and hernias at the incision sites. In rare cases, some patients may experience long-term effects, such as chronic diarrhea or digestive issues, commonly referred to as post-cholecystectomy syndrome. These symptoms occur because bile is no longer stored in the gallbladder and flows directly into the small intestine, which can sometimes lead to digestive disturbances. Dietary adjustments and medications can help manage these symptoms. Life after gallbladder removal. Living without a gallbladder typically requires some lifestyle adjustments, especially regarding diet. Patients are advised to eat smaller, more frequent meals and avoid large fatty meals that can be difficult to digest. A diet high in fiber and low in fat can help reduce digestive discomfort. It is also important to stay hydrated and maintain a healthy weight to support overall digestive health. Many people wonder if they will be able to eat normally after gallbladder removal. While most people can return to a regular diet after a period of adjustment, some may need to avoid certain foods that cause discomfort. Another frequently asked question is whether gallbladder removal affects the liver. The liver continues to produce bile even after the gallbladder is removed, so liver function is generally not affected. Additionally, people often ask about the risk of developing gallstones after gallbladder removal. While it is rare, stones can form in the bile ducts, but this can be managed with medical treatment. In conclusion, gallbladder removal surgery is a common and effective treatment for conditions such as gallstones and cholecystitis. With proper care and lifestyle adjustments, most people can lead healthy, normal lives without a gallbladder. Remember, every individual's experience is unique, and your healthcare team is there to guide you through every step of the journey. Now, we want to hear from you. Do you or someone you know have gallbladder removal surgery before? How was your experience? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.